We will proceed with the section of acid-base imbalance. Section 3. Acid-base imbalance. 1. Metabolic acidosis, featured by plasma bicarbonate primary reduction, is the most common type of acid-base imbalance in clinic. 1. Etiology. Number 1. Excessive loss of bicarbonate, pancreatic fistula, intestinal fistula, diarrhea. Number 2. Excessive acidic substances, hypokalemia, shock, infection, fever. Number 3. Fixed acid discharge barrier. 2. Clinical manifestations. 1. Deep and fast breathing, obvious contraction of respiratory muscle, and rate up to 40 to 50 times per minute. 2. Fatigue, drowsiness, dyslithia. Number 3. Flash, palms rise, blood pressure drop. Number 4. Muscle force down, tendon reflexes weak, disturbance of conscious or coma. 5. Arrhythmia, acute renal insufficiency, shock. 3. Diagnose. Number 1. Medical history and clinical manifestations. Number 2. Arterial blood gas analyze, pH less than 7.35, bicarbonate less than 22 millimole per liter. BE elective value rise. 4. Treatment. 1. Remove etiology. Number 2. Supplement fluid and correct shock. Number 3. Supplement alkali. Patient of severe acidosis with plasma bicarbonate less than 10 millimole per liter. There is a formula for calculating the amount of supplementary alkali. Sodium bicarbonate equaled bicarbonate minus difference value multiply body weight multiply 0.4. Half amount of supplementation first. Adjust according to blood gas index after 2 to 4 hours. 4. Pay attention to correct low potassium ion. Low potassium mass formed by blood stasis. Metabolic alkalosis, featured by plasma bicarbonate primary increase. 1. Etiology. 1. Excessive loss of acidic gastric fluid. Number 2. Excessive intake of alkaline drug. Number 3. Hypokalemia. Number 4. Diuretic hypochloremia. 2. Clinical manifestations. Number 1. No obvious symptoms in journal, and hypodia may occur. Number 2. Neurological problem, mental disorders, drowsiness, delirium, and a severe coma. Number 3. Hypokalemia and dehydration may occur. 3. Diagnose. Number 1. Medical history and clinical manifestations. Number 2. Arterial blood gas analyze, pH more than 7.54, carbonate more than 27, BD positive value rise. Number 3. Often accompanied by hypochloremia and hypokalemia. 4. Treatment. 1. Deal with primary disease. 2. Take NS or GNS, and low acid drugs is needed for a mild case. 3. Supplement potassium ion. 4. Take 0.1 mol per liter dilute hydrochloric acid to correct severe case. 0.1 mol per liter dilute hydrochloric acid, 150 milliliter plus NS 1000 milliliter, intravenous drip, 25 to 50 milliliter per hour. 3. Respiratory acidosis, featured by primary increase of plasma carbonic acid concentration. 1. Etiology. 1. Central respiration repression. 2. Physiological changes of airway and lungs, and obstruction of respiratory tract. 3. Pathological changes in respiratory muscles. 4. Improper use of ventilator. 2. Clinical manifestations. 1. Earlier stage, facial flash, chest tightness, dyspnea, restlessness and headache, cyanosis pressure rise, blood pressure rise. 2. Late stage, delirium, coma, blood pressure drop. 3. Diagnose. 1. Medical history and clinical manifestations. 2. Arterial blood gas analysis, pH less than 7.35, carbon dioxide partial tension more than 6 kPa. 4. Treatment. 1. Etiological treatment. 2. Improve ventilation function. 3. Mechanical ventilation. 4. Respiratory alkalosis, featured by primary reduction of plasma carbonic acid concentration. 1. Etiology. 1. Fever, trauma, pain, and hypoxia. 2. Hysteria, tension. 3. Improper use of ventilator. 2. Clinical manifestations. 1. Chlomia and increased heart rate. 2. Vertical, peripheral numbness, tenacity. Muscle fibrillation, positive trousseau. 3. Diagnose. 1. Medical history and clinical manifestations. 2. Arterial blood gas analysis, pH more than 7.45, carbon dioxide partial tension less than 4.67 kPa. 4. Treatment. 1. Etiologic treatment. 2. Inhale 5% mixed gas of carbon dioxide, or cover mouth and nose with paper bag to inhale the exhale carbon dioxide so as to maintain plasma bicarbonate acid concentration. 3. Sedation, mental overbreathing. 4. Adjust ventilator parameters. 5. Intravenously inject calcium gluconate for patient with tenacity. Today's lesson is over. See you next lesson.